5 medicine could increase your risk of a heart attack. Heart disease remains the leading cause of death globally, with heart attacks claiming millions of lives each year. While medications are designed to heal, certain drugs may inadvertently elevate cardiovascular risks. This article reveals 5 commonly prescribed medications linked to an increased heart attack risk. From pain relievers to antidepressants, these treatments, though effective for their intended purposes, may pose hidden dangers. Many patients remain unaware of such side effects, underscoring the need for awareness. Always consult your healthcare provider before adjusting your regimen. Knowledge empowers you to safeguard your heart and make informed medical choices. Stay informed. Recognizing these risks could be life-saving. 1. NSAIDs. Non-steroidal anti-inflammatory drugs like ibuprofen, Advil, Motrin, naproxen, Aleve, and diclofenac are widely used to relieve pain, inflammation, and fever. However, long-term or high-dose use can increase heart attack risk by up to 50%, according to the Journal of European Cardiology. NSAIDs inhibit cyclooxygenase, COX, enzymes, reducing pain-causing prostaglandins, but also disrupting protective prostaglandins that maintain blood vessel elasticity and prevent clotting. This imbalance can lead to hypertension, fluid retention, and narrowed blood vessels, raise blood pressure, blood clots, reduced anti-clotting prostaglandins, increase thrombosis risk, plaque rupture. Inflammation of arterial plaques may trigger blockages. What you can do: limit NSAID use to short-term relief, under 10 days. For chronic pain, explore alternatives like acetaminophen, Tylenol, or physical therapy. Always consult a doctor if you have pre-existing heart conditions. 2. Certain antidepressants. Selective serotonin reuptake inhibitors, SSRIs, like citalopram, Celexa, and serotonin norepinephrine reuptake inhibitors, SNRIs, like duloxetine, Cymbalta, are generally safe, but tricyclic antidepressants, TCAs, such as amitriptyline and nortriptyline, have been linked to cardiovascular risks. TCAs interfere with heart rhythm by blocking sodium and potassium channels, potentially causing arrhythmias, irregular heartbeats like ventricular tachycardia, orthostatic hypotension, sudden blood pressure drops strain the heart, increased heart rate, prolonged tachycardia stresses cardiac tissue. A 2013 BMJ study found TCAS raised heart attack risk by 35% compared to SSRIs. What you can do: if prescribed TCAs for nerve pain or depression, ask about newer antidepressants with fewer cardiac side effects. 3rd, proton pump inhibitors, PPIs like omeprazole, Prilosec, and esomeprazole, Nexium, reduce stomach acid for GERD and ulcer treatment. However, long-term use may impair magnesium absorption, which is vital for heart rhythm regulation. A PLOS One meta-analysis found a 16 to 21% increased heart attack risk in PPI users, possibly due to endothelial dysfunction, reduced nitric oxide production limits, blood vessel dilation, drug interactions. PPIs may weaken the anti-clotting effects of aspirin. Magnesium deficiency. Low magnesium levels can trigger arrhythmias. What you can do: use PP is only as prescribed, typically 4 to 8 weeks. For acid reflux, try H2 blockers, e.g. famotidine, or lifestyle changes like weight loss and avoiding trigger foods. 4. Diabetes medications. Rosiglitazone, Avandia, a once popular type 2 diabetes drug, was found to increase heart attack risk by 43% in a 2007 New England Journal of Medicine study. It works by improving insulin sensitivity, but also causes fluid retention. Excess fluid strains the heart. LDL cholesterol spikes. Higher bad cholesterol accelerates atherosclerosis. Heart failure. Weakened cardiac muscle pumping efficiency. While the FDA restricted rosiglitazone in 2010, it remains available under strict guidelines. What you can do. Newer diabetes drugs like SGLT2 inhibitors, e.g. empagliflozin, and GLP-1 agonists, e.g. semaglutide, are safer for the heart and improve outcomes. 5. Decongestants, pseudoephedrine, phenylephrine. Decongestants like Sudafed, pseudoephedrine, and phenylephrine narrow blood vessels to relieve nasal congestion. However, this vasoconstriction can raise blood pressure. Dangerous for those with hypertension. Increase heart rate. Strains the heart, especially during physical activity. Trigger arrhythmias. Adrenergic effects may disrupt electrical heart signals. A JAMA study noted a 3 to 5% rise in cardiovascular events in high-risk individuals using decongestants. What you can do. Opt for saline sprays, antihistamines, e.g. loratadine, or steam inhalation. Avoid decongestants if you have heart disease. Prevention and proactive steps. Review medications. Annually. Discuss all prescriptions, over-the-counter drugs, and supplements with your doctor. Monitor heart health. Regular checkups for blood pressure, cholesterol, and ECG screenings. Lifestyle modifications. Diet, exercise, and stress management reduce reliance on risky medications. Know the signs. Chest pain, shortness of breath, and dizziness warrant immediate medical attention. Conclusion. While these medications serve important purposes, their cardiovascular risks highlight the need for cautious, individualized use. Never stop a prescribed drug abruptly. Sudden discontinuation can worsen conditions. Instead, work with your healthcare provider to weigh benefits against risks and explore safer alternatives. By staying informed and proactive, you can protect your heart while effectively managing your health. Disclaimer. This article is for informational purposes only and does not replace professional medical advice. Always consult your physician before making changes to your treatment plan.